Thank you. शुक्रिया. अस्सलाम वालेकुम. आप लोग आवाज सुन पा रहे हैं मेरी?
वालेकुम अस्सलाम. यस मैम.
स्क्रीन नजर आ रही है आपको?
Fever and rash.
जी. Okay. So, Assalamu alaikum everyone. I am Dr. Nazia Khurshid. I am a consultant microbiologist at Indus Hospital and Health Network. And today I will be sharing some knowledge regarding fever with rash. So, you all know what is fever? The rise in temperature from normal. Along with that, if there are different kind of rashes in the body, it comprises of a group of infections along with non-infectious manifestations as well. So we will be having an overview of some of the diseases during the lecture, as well as different kind of rashes, their definitions and examples of the diseases, and things which should be kept in mind with, when we are dealing with the patient presenting in the hospital with fever and rash. So if there is a noticeable change in texture and color of the skin, it is called rash. It may be red, the area may be itchy, it may be bumpy and irritated. The differential diagnosis is extensive, and there are some variables which must be taken into account to get to the proper diagnosis of the disease. Then we are going to discuss the classification as well, and they are classified according to the morphology of the primary lesion or according to the type of the pathogens causing the disease. Rash can be defined as a cutaneous eruption due to systemic effects of pathogens. Now, there are various mechanisms which are involved as in the etiology of rashes. For example, the organism may multiply in the skin and can lead to rash, such as in herpes virus infection, herpes simplex virus infection. There may be multiplication of the virus in the skin. Secondly, there may be release of toxins that can act on skin structures. The toxins are basically causing the rash, not the multiplication of organism. So the toxins can cause diseases like scarlet fever, infections due to Pseudomonas aeruginosa toxic shock syndrome, and staphylococcal scalded skin syndrome. So there is a difference among these two. In one, the organism are multiplying. In the other, the organism are multiplying, and along with that, they are producing toxins, and basically the toxins are the cause of manifestations. Thirdly, there may be inflammatory response involving phagocytic and lymphocytic cells, and there may be effect on vasculature causing constriction or dilatation of the vessels. For example, sepsis by gram-negative rods. So this is, sorry, a busy slide, but it is here just to give you an idea that rashes may be non-infectious. Stevens-Johnson syndrome, antibiotic. Today, we are going to focus on the infectious causes of fever and rash. All these infections which are caused by microorganisms with fever, they Should assess and take a history. If he is in a state of giving history, along with that, important thing is some infection. Precautions and the transmission based precautions, for example in syphilitic lesions, for example in herpes simplex virus lesions. Thirdly, the another thing to take into account is the requirement of antibacterial therapy. For example, in meningococcal disease, we need to give during the past 1 month. Things to be considered include, as I told you, a very nice detailed history, physical examination, history of recent travel, forest or animal exposure, drug ingestion within the past 30 days, and contact with ill persons like a person suffering from chickenpox, a person suffering from measles. It should be taken into account. What are the key factors to the correct diagnosis of the disease? There are a few variables which should be taken into account, like type of the primary skin lesion. What type of lesion is there? We are going to discuss the types in details later on in the presentation. The second thing is the pattern of progression, like rash in fifth disease caused by parvovirus. Is there is streaky facial involvement of the patient. Furthermore, there is a rash maybe on account of the use of antibiotics like beta-lactam agents like sulfonamides, leading to maculopapular rash. So a good history can help you in diagnosing the right cause. The distribution of the rash is also very important, like meningococcal disease and Rocky Mountain spotted fever spread centripetally. That means away from the body, centripetally it goes, and most drugs reactions and viral infections start timing of the rash relative to fever, relative to illness, like use of antibiotics in the previous 7 to 10 days, maximum up to 4 weeks. For example, there is a syndrome, not very common, it is called Steven-Johnson syndrome, which affects the skin and the mucous membrane. And there is a reaction to medication. It starts with flu-like symptoms and followed by painful rash, which spreads. Blisters may appear, and the top layer of the skin may shed. This may be due to antibiotic like sulfonamides, anti-gout therapy, antipyretic agents. So these are the factors which help you to lead to the diagnosis. Then we have important keys like type of the lesion and knowledge of the individual pathogen. What type of rash is caused by a particular pathogen? Say, for example, measles virus or any bacterial lesion caused by staphylococci or streptococci or gram-negative rods like Pseudomonas aeruginosa. So we need to have knowledge about the pathogens as well. So common primary skin infections, which I told you we are going to discuss later, are these. These are the different type of lesions which you can come across while dealing with a patient with fever and rash. The first one is macule. Macule is a circumscribed area, no skin elevation or depression. It is in the plane of the skin and there is no elevation, no depression. It can be of any size. The important thing is this, that it is not palpable. You cannot palpate it since it is not elevated. There is no depression. It is just a circumscribed area. Papule is palpable. It is solid, small, raised lesion. Small lesion may be up to 0.5 centimeter. If the large size of papule is encountered, which is roughly more than 0.5 centimeters, then the name changes to nodule. So if it is a small lesion, it is palpable, solid and small, it is papule. When there is increase in size, roughly more than 0.5, then it becomes nodule. We call it nodule. There is another type of lesion which is called vesicle. The lesions are there which contain fluids. If they are small fluid containing lesions, they are called vesicles. If they are large fluid containing lesions, they are called bullae. Another type of lesion is pustules. They are usually small, they are palpable lesions, and as the name shows, they are filled with pus. Pussy lesions which are palpable are called pustules. Plague, large, flat, palpable lesions. So macule is not palpable. It can be of any size. There is a circumscribed area. Papule is palpable, raised, small in size, roughly about 0.5 centimeter. When the size increases, we call it nodule. If it is a lesion containing fluid, we call it vesicle. When the size increases, we call it bullae. If there are lesions filled with pus, we call pustules. If it is a lesion which is flat, palpable, large, about 1 centimeter, these are called plagues. And this slide is showing the maculopapular rash. Now we are discussing the different type of rashes which I just defined to give you a good idea and some of the examples of the diseases. Maculopapular rash, you can see in the picture as well, can occur in common viral illnesses because of drug use, because of immune complex mediated diseases, childhood fevers like measles, rubella, roseola caused by herpes simplex virus are very good examples of maculopapular rash. Then we have other examples like CMV virus, hepatitis B virus. They can also cause this kind of lesion. Erythema multiforme is a type of maculopapular rash, and there are target lesions, meaning that there is erythema, then there is an area of normal skin, again there is another area of erythema. So two erythematic zones surrounded by, I should say, in between the two erythematic zone, there is a normal skin zone, and it resembles the target. So target which you use to play and shoot arrows. So that is why it is called target lesion. It can occur in herpes simplex virus 1 and 2 infections. There may be generalized rash. It can affect the knees, the elbow, the palms, and the soles. So maculopapular rash can occur in different kind of viral infections, and secondary syphilis can also lead to maculopapular rash and pustules. So bacterial infection, syphilis is an example. Then there are many examples of the viral diseases. Now moving forward to nodular lesions. This may occur in immunocompromised patients, they may be suffering from HIV, and in these patients there are more chances of getting the fungal infections, the candidal sepsis. Then they may get blastomycosis, coccidioidomycosis, different kind of fungal infections. Then bacterial diseases like nocardial infections, mycobacterial infections, for example, Mycobacterium marinum infections, which can ulcerate. Then an erythema gangrionosum is a type of nodular lesion, which is deep, punched out ulceration, and there are black scars. Sorry for the spelling mistake here. It's black scar and peripheral erythema. It can occur in pseudomembranous sepsis as well, Pseudomonas aeruginosa sepsis. So nodular lesions. You can see this in the picture as well. Then diffuse erythema may occur, and there is de-squamation and peeling off of the skin, which may be seen in case of staphylococcal infections, staphylococcal and toxic shock syndrome caused by staphylococci, then scarlet fever caused by streptococci. Another type of lesion is the vesiculobullous lesion. You can see the image. You can see the vesicles and the bulli. So, do you remember what we discussed in the previous part of the lecture when we were discussing the different type of lesions? Vesicle and bulli, small blisters filled with fluid vesicle and large blisters filled with fluid bulli. So this slide is showing you the vesicles and bulli both. Examples of the infections which may lead to such